So we now move to the next speaker, who is Benjamin Carey, and he is one of our patients, and who jokes that his long and varied career in travel and tourism didn't prepare him enough for his most unexpected recent journey.
Good morning. I'm delighted to be here. I'm here because my GP was curious about my HbA1c. I'm probably also here because for 6 months my cholangiocarcinoma was misdiagnosed and I was treated for something else. I'm curious that there are so many questions that came up during the 18 months of my journey that didn't have straightforward answers. People had to ask other people. There was lots of debate. It wasn't straightforward. And today I want to pose a number of questions which, if there are clear answers, and I sense that recommendations are now coming through the guidelines, so there will be clear answers, but I want to try and make sure that others who come after me have a slightly easier time of their unexpected journeys. I'm not a scientist, I'm not a medic. I specialize in tourism policy. Towards the end of 2022, my life changed. I took this photo in Bangladesh in the middle of 2022. I was traveling every 2-3 months, and I think on the 8th of December, I was meant to be flying back to Bangladesh. And the day before, my GP rang and said, "You are not going to Bangladesh, you are going to hospital." This was my third time of trying to get into hospital. So I'm going to tell you a bit about my journey, then I'm going to say a few thank yous, and then I want to raise a number of questions. So my family has diabetes, fatty liver, Gilbert's. This is speculation. My father was diagnosed with stage 4 hepatocellular carcinoma 4 weeks before he died. He didn't have a biopsy or post-mortem, and the literature suggests maybe it was intrahepatic cholangiocarcinoma. I'm told I probably didn't have flukes, but I'm always trying to understand why me? Why did I get cholangiocarcinoma? I would love to have an explanation. My HbA1c was pretty stable for several years, and then suddenly in the middle of 2022, it doubled over a few months. And then in November, I started getting cramp. I had spasms in my feet and my sort of toes cramped. And I went to a local pharmacist and they said, try some magnesium, which helped. But I went to my GP and they were puzzled and curious about my HbA1c, and they sent off a whole load of the liver function tests, and they came back deranged. My bilirubin went up to 199 when I went into hospital. I went into hospital on the 8th, on the evening of the 7th of December. I had a bit of treatment, I was stented, and then numbers sort of started coming down. But deranged, I think, is a fair comment. I'd had an X-ray, nothing. I had a ultrasound, unremarkable, nothing. And then in December, I was admitted, finally, my third visit to hospital. And CT in one room, just down the corridor. Half an hour later, I was prepped for a liver biopsy. And they had the needle out, I was all ready, and then the consultant radiologist came in and had a quick glance at the CT images, and they said, "No, I'm going to send you back to the ward." And we'd been having a lovely conversation about travel, and suddenly the whole atmosphere in the room changed, and I didn't really get it until later that day. So a big mass was found on my pancreas, I was on a liver ward, and over the next few hours, the liver consultant had a conversation with a surgeon, had a conversation with the clinical nurse specialist, and suddenly things started happening. But they came to find me in my bed, took me to a side room, and said, "You have a large lesion in your pancreas. It's touching the portal vein. It's pancreatic ductal adenocarcinoma, borderline operative. The prognosis is uncertain." I knew people who'd had pancreatic problems before, and I knew I probably wouldn't see at Christmas. Anyway, I was stented, given a few more bits of treatment. I was started on insulin, given a lovely Porticath in January, which actually came out last week, which I'm very pleased with. And then I had FOLFIRINOX for 3 months, which is the standard line 1 treatment for pancreatic cancer. I was told that over 70 people respond to FOLFIRINOX. When you look at the literature, it's actually 31% where the tumor is reduced. Yes, it will stabilize in most cases, but it was unlikely it was going to be reduced enough, and certainly not enough to take it away from the portal vein. But in April, I was told that it reduced from 30 millimeters to 14 millimeters, which was a pretty good result. I then had Whipples. Lots of nodes were taken out. I was given a bovine patch. Lots of pain, lots of hallucination, but mostly very good pain management. June 23, there was an MDM, and there was an MDM. The surgeon rang me up straight after the ADM and said, there was a tumor, there's good margins around it, all the nodes were clear. But actually, you had cholangiocarcinoma. What's that? I'd never heard of it, and suddenly I had to read a few more papers. I was put on capecitabine for 6 months, and then over the last few months, I had a CT and was told, no, atypical, inconclusive. Then I had an MRI, again, atypical. But on a Friday evening, I was driving in the car with my kids, and at 5 to 6, the phone went hands-free, and the oncologist sort of said, yes, it is atypical, but it looks like it's just fatty liver, bit of scarring, but you are cancer-free. And then at 6:10, another oncologist called me on a Friday evening and said exactly the same thing. I think they were quite excited to be able to tell me some good news before the weekend, and I was very, very pleased. I want to say a few shout-outs, a few thank yous. So the first 6 months of my journey, I was with another charity, but what's been important with AMMF over the last 9 months now is the patient forum, and talking to other patients about their experience, getting hope, understanding journeys, and it's been really important to understand experiences. Some are grim, but there is humor, there is positivity, and there's sharing. And it is desperately important. And having patients in this forum, I think, does sound to be fairly unique, but it is very positive. So thank you, AMMF. I was referred to Maggie's and Macmillan immediately. I had a brilliant psychologist at Maggie's, and they helped me talk about death and think about my funeral. My sons wrote eulogies for me. But also, since I've been given cancer-free, my psychologist is helping me transition from the probability of death to the possibility of life, which is incredibly hard. The psychology, I know there's a session on this later, but the psychology of diagnosis is awful. Macmillan were great, huge number of medics of different kinds. But I want to say something about the clinical nurse specialists. So within 24 hours of my diagnosis back in December 22, I had had referrals to Maggie's and Macmillan. The clinical nurse specialists had sat my kids down and explained to them the diagnosis and what it meant. I was quite tearful during that time, and I had several hugs. The clinical nurse specialists are probably the most important people in my journey. They advocate for me in MDMs. They help me navigate everything. They are absolutely crucial, and they should be part of any decision-making about how to manage cholangiocarcinoma. So, and I know that some of them are watching, so thank you, wherever you are. I've put my questions into 3 sections. I read a lot of papers whilst I was on this journey. I think my wife read even more. And we learned a lot. But what was clear is that there's not a lot of data. There are not clear answers to what, for me, seemed like quite straightforward questions. So initial diagnosis and treatment. When should CCA be investigated? I went into hospital 3 times before I was told I had cancer, in a very short space of time. How do you differentiate between pancreatic cancer and cholangiocarcinoma? In what circumstance should FOLFIRINOX be used? In my case, it was spectacularly successful. It is a popular treatment in Asia. I haven't seen it mentioned that much in this conference, but for me, it worked, and I wouldn't want anyone to miss out on that, but I know it's not the first-line treatment for cholangiocarcinoma in the UK. After surgery. My instinct was, I want some more FOLFIRINOX because I know it worked for me. I want to give me another 3 months, 6 months, however much it takes. My oncologist said capecitabine. There's good evidence for that. And I didn't want to make a mistake. I was told that there were good margins and I was probably clear. But I didn't want to miss out on the best chance because FOLFIRINOX for me worked. And I then asked a friend who asked sort of his oncology mates, and it all came back, and they said, no, capecitabine. So I did 6 months. There was also a question of, I'd had 3 months of 5-FU, but when I had FOLFIRINOX before, so maybe I should only do 3 months. But I said, no, let's just do the full 6 months and make sure this thing never comes back. Whilst I was on capecitabine, my bilirubin shot up. It went up to nearly 100 after each cycle. And the general view was, we'll just live with that. And we did, and it was okay. But in the case of Gilbert's, what level of bilirubin is safe? There shouldn't be debate about it. Gilbert's isn't so rare that there shouldn't be a guideline there. I haven't had molecular profiling because it's all out. Should I? I don't know. This is a very specific question that I asked AMMF. What is the gold standard for management after you've been told you're cancer-free? Europe says 5 years follow-up. UK says maybe 2 years. There isn't a clear standard. I don't want to have to sort of advocate and to say, I want this, I want that. I want there to be a standard. And there needs to be a clear protocol. And I don't think there is, I don't think even in the guidelines. I was also given a bovine patch because around my portal vein needed to be reconstructed. Apparently there's a lack of evidence about how long should you stay on a Pixaban. And just because there's a lack of evidence, I don't want to stay on a drug unnecessarily for the rest of my life. I'd like to know. It may be partly fatty liver, it may be slightly chemo-induced scarring, but should I give up alcohol? Am I going to now get cirrhosis? I don't know. What is the likelihood of recurrence? The million-dollar question. I will live one day to the next and enjoy life and be positive, but all the statistics that say it's likely that there'll be a recurrence 30% over the next few years, I hope it doesn't happen to me, but I'm glad there are people researching a lot of these questions, and I'd love to see more and more research to make sure that those who come after me have a more expected journey and they come up with a good outcome. Thank you very much.